Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 9th August 2025. This video is on a JACC article published on 6th August 2025 titled Effect of HEPA Filtration Air Purifiers on Blood Pressure, a pragmatic randomized crossover trial. There was an accompanying editorial titled Breathing Easier, Air Filtration to Improve Indoor Air Quality as a Cardiovascular Intervention. Particulate matter from traffic, especially less than 2.5 microns, and ultrafine particles less than 0.1 microns is linked to high blood pressure and cardiovascular disease. Even small increases in systolic blood pressure raises the risk of ischemic heart disease and stroke. In-home, high-efficiency particulate arrestant filters, or HEPA filters, can remove 99% of fine particles, less than 0.3 microns, potentially lowering cardiovascular risk. This was a pragmatic randomized crossover trial in 108 residencies near high-traffic highways in eastern Massachusetts. 154 adults, mean age 41.1 years, 59.7% were women, 68.2% were non-Hispanic white, and majority had higher socioeconomic status. 30 days of HEPA filtration versus sham filtration separated by a 30-day washout. Units were installed in bedrooms and living rooms. Blood pressure was measured at start and end of each intervention. And PM₂.₅, that is less than 2.5 microns, and particulate number counts were measured in a subset, 19 for PM₂.₅ and 8 for particulate number count. Statistical analysis included linear mixed models adjusted for age, gender, baseline blood pressure, time indoors, outdoor temperature, and perceived stress scale. What did they find? They found that there was a reduction in particulate matter. The mean indoor PM₂.₅ reduced from 5.2 micrograms per cubic meter in the sham group to 2.5 micrograms per cubic meter in the HEPA group, p-value 0.001. Particulate count decreased from 6,925 to 4,706 particles per centimeter cube, p-value 0.001. Overall, there was no significant changes in systolic blood pressure, p-value 0.56. But when the baseline blood pressure was elevated greater than 120 millimeters of mercury, there was a significant decrease by 2.8 millimeters of mercury with HEPA versus an increase of 0.2 millimeters with the sham group. So the net decrease was 3 millimeters, p-value 0.04. No significant change in diastolic blood pressure for any group. To the well-blinded study, the James blinding index was greater than 0.83. Limitations: the benefits of HEPA were limited to elevated systolic blood pressure subgroup, higher socioeconomic and racial homogeneity in this study. It excluded those on antihypertensives, seasonal recruitment bias, and unclear summer effect. Indoor temperature not consistently measured. Effect timing not fully assessed. Key takeaways: HEPA air purifiers significantly lowered systolic blood pressure in those with elevated baseline blood pressure, even in low particulate matter environments. Potential cardiovascular benefits: 2 to 3 millimeters of systolic blood pressure reduction, which is associated with a 5 to 9% lower ischemic heart disease mortality risk. Reasonable to recommend for vulnerable populations near high traffic roads. One more additional point: most of the people in this trial lived less than 200 meters from major roads. Editorial perspective. The editorials say that the strengths are rigorous design, double-blinded, real-world setting, extends prior small trials, confirms harms of particulate matter 2.5 microns at low levels. Concerns of the study: subgroup analysis of those with elevated systolic blood pressure was not pre-specified. and unequal sizes, 91 versus 61, which increase the risk of chance finding. Absolute reduction in particulate matter 2.5 was small, around 2.7 micrograms per cubic meter, yet the effect size was large versus prior meta-analysis for about 4 millimeter mercury drop with 20 microgram per cubic meter reduction in particulate matter 2.5. Inconsistent ultra fine particle reduction. Particulate matter 2.5 micron alone may not fully capture toxic exposures. Limited blood pressure measurements per visit. They recommend ambulatory or self-measured blood pressures could improve precision. Future directions, according to the editorialists, test sustained blood pressure lowering around greater than 1 year. Identify optimal target groups, for example, elevated systolic blood pressure stage 1 hypertension patients. Assess benefits in vulnerable and lower and middle income country populations. And determine interaction with lifestyle or drug therapy. The key takeaway of the editorialists is HEPA filtration is a low risk, potentially beneficial adjunct for elevated systolic blood pressure in your traffic population. Best targeted and validated in pre-specified, adequately powered trials. An interesting principle in this study was the Wilder principle, which states that the body's response to a stimulus depends on starting baseline value of physiological parameter. High baseline values, greater reduction when stimulus lowers the parameter. Lower baseline values, smaller changes or even increases. Described by John Wilder in 1931. Widely applied in cardiovascular, autonomic, and endocrine physiology. This study used the James Blinding Index, and the James Blinding Index quantifies how well blinding is maintained in clinical trials. Scale 0 is complete unblinding, 0.5 is random guessing, adequate, 1 is perfect blinding. If the lower bound of the 95% confidence interval is greater than 0.5, the trial is considered well blinded. The calculation incorporates proportions of correct guesses, incorrect guesses, and don't know guesses, adjusts for bias from don't know responses by giving partial credit. This trial, after the first intervention period, the blinding index was 0.87, and after the second intervention period, the blinding index was 0.83, both well above 0.5. So excellent blinding was maintained. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.